name is Keith Knurr. I'm an assistant professor at the University of Wisconsin-Madison. And Claire Reynolds, who's not here yet, but hopefully she'll be joining, helps coordinate this bi-monthly webinar series with me. And so really the focus of this webinar series is to gain a deeper insight into various topics related to sports physical therapy and dive into a specific research paper. By interviewing the authors. So today, the webinar was organized by the Golf Special Interest Group, specifically by Lindsay Becker, who will be our interviewer today. And then just a little housekeeping before we get started. The session's about 30 minutes. The way we structure this is 30 minutes of kind of more of the formal interview back and forth conversation. So at that point, please keep your mics muted. If you have any questions during that period, please drop them in the chat. And then the second half, we'll kind of open it up to questions. So at that point, please feel free to come off of your mic, turn your video on, ask your question. Just remember this is recorded. And if you don't want to do that, again, drop it in the chat. I'll relay that message to the group and moderate that throughout. And then the last thing is that this will be posted or should be posted on the Academy Learning Center a few days after the event. So if you know of colleagues that were unable to attend, but you really think this would be of interest to them, please share it, spread the word, and we'll get this out to as many people as possible. Okay, so with that said, today we will be discussing a recently published paper in Sports Health titled Sex Differences in Youth and Young Adult Sports Training Patterns, Specialization, and Return to Sport Duration. And this was in the January of 2025 edition. Lead authors and is it Busser? Is that how you? Or
I say Buser, but
Buser. Okay, no, you say your name the way you say it. So Anna Buser. And then we also have Stacey. I should ask this before. Schley. All right, Schley. Yeah. And then we also have the senior author on this, Neeru Jayanthi. Is that close?
I'm sorry about that if I butchered that. You're good. Yeah, you're good. Yeah.
All right. So with that said, I will stop talking and pass it off to Lindsay and let Lindsay give her introduction and then go around the panel here.
Perfect. Thanks, Keith. So I'm Lindsay Becker. I'm the chair of the Golf SIG in the Sports Academy. So I'm in Columbus, Ohio. I work with a ton of golfers and particularly a lot of junior golfers, kind of ages like 9 through high school and college. So this is certainly a topic that is interest to us because we are always kind of discussing, and with parents and with kids of, when do they specialize in golf? Should they give up basketball? Should they give up lacrosse? How are we managing all of our tournaments, and then what's going to get us best into college and all of that stuff, and then trying to obviously not get injured in the meantime. And so that's this was kind of an interesting topic to me. So, but I want to have you guys introduce yourselves. So, a little bit of background about you guys, and then also kind of why you wanted to even look at this topic. So Anna, if you want to start.
Yeah, for sure. Hey y'all, I'm Anna Buser. I am a second-year family medicine resident at Wake Forest in North Carolina. For background, I ran cross country and track throughout high school and college, and I still sometimes pretend I'm a student athlete trying to balance academics and training for races during residency. After college, I spent a few years at the NIH doing clinical genetics research, and then went to med school at Emory, and that's where I got connected with Dr. Jayanthi and Dr. Schley, who were studying this, and they were the ones who graciously introduced me to the world of sports medicine and sports specialization. So I can hand it off to Stacey.
Yeah. Hey, everyone. I'm Stacey Schley. I am a physician at Boston Children's Hospital, and I'm part of the female athlete program. So I do some traditional sports medicine work, but also focus on female athletes and specifically a lot of work in the arena of relative energy deficiency in sport, which used to be the female athlete triad. So sports performance work, menstrual cycle irregularities, bone stress injuries. So getting on the topic of overuse injuries in the setting of fueling inadequately and overuse. But before that, I went to University of Wisconsin-Madison, actually, Keith, for my family medicine residency. Shout out to the Midwest. And then went to Emory for my sports medicine fellowship. And so that's where I met Dr. Jayanthi and did some sports specialization work. And then I actually came up to Boston, did a second-year fellowship focusing more in this red sports endocrine space here, and then stayed on as faculty. So I'm passionate about sports specialization through Dr. Jayanthi. I think focusing on the sex differences between athletes is really important, and I can speak to that more after Dr. J introduces himself, but definitely need more topics comparing our sexes and focusing on differences in terms of injury profiles and recovery profiles as well. Pass it off to Dr. J.
Hi, everyone. And I see some names on your Liz Chapin. Hey, long time. Great to see you. Lauren Erickson, I think we've crossed paths as well, and some others. So thanks for you guys for jumping on. And you know, I've been fortunate to be around this space for about 20 years or so. And it's always stimulated by awesome, awesome students, residents, fellows. And the first paper we wrote was with a medical student, Courtney Pinkham, that ended up getting published in Sports Health. And then we did a bigger study on sports specialization. And we've followed this stuff for a long time, and really is, again, stimulated by awesome people. So when Stacey, and then I had, you know, Anna as well too, at the same time, like, we have got to write about sex differences. And I do a little work. I run a tennis medicine program, and the fellowship and youth athletes are all my interests. But with WTA player development, as Liz knows, it's really important. These things are really important for certain organizations. So anyway, we felt like it was just a great momentum to talk about the differences with the female athlete. And I think this paper is one of my favorite papers. Anna Buser won the best oral research presentation at Emory School of Medicine for this paper out of 150 students. And, you know, just so proud of her and everything that Stacey's done. So I am just gonna sit back and listen and let these guys run the show.
Awesome. Well, thank you guys for the introduction. So I guess let's get right into it. Like, tell us about the paper. So tell us, yeah, kind of what you guys found and your results and whatnot.
Yeah, I can take a stab at that. So, you know, big picture, why are we even doing this? You know, I don't need to tell y'all, but kids who play and participate in sports have lower risk for developing metabolic syndrome down the line. They have less depressive symptoms, greater self-esteem, and sports are fun, right? We want to keep kids in sports. There's so much we can learn for it, and injuries keep kids out of sport. So, you know, big picture, trying to figure out ways that we can help reduce injury risk. And time again, there's been a lot of papers in the literature, a lot of them spearheaded by Dr. Jayanthi, about how sports specialization increases risk of injuries in youth athletes. And it's independent of training volume. So it's not the number of hours that they're playing in their sport. It's really the specialization is a risk factor. Higher degrees of sports specialization have been shown to have higher risk of overuse injuries and serious overuse injuries. And again, in the literature, time and time again, female athletes are at higher risk of overuse injuries. And this has been shown not just in clinic-based studies, but also in field-based epidemiological studies that female athletes are at higher risk. So with this, you know, we wanted to say, okay, well, what is the gap? What is causing this? And a lot of the other risk factors that have been studied at the same time have shown that there are other risk factors that can cause injuries, and have also just kind of stated at the bottom of the paper, like, oh yeah, and female athletes are also at risk. But they didn't actually look at those training differences to see, hey, is there actually a difference in how our male and female athletes are training? So we wanted to take a deeper dive into that. The other thing that hasn't really been shown in the paper in the literature, to my knowledge, is if specialization is associated with any increased return to sport. So we know that specialization increases your risk of injury, but do higher degrees of specialization, those injuries that you're getting, are those injuries actually keeping you out of sport for longer periods of time? So that's what we kind of set out to do. So to do that, we researched the patients we were already seeing in clinic. So any athlete who was aged 10 to 23 who had sustained an injury from their organized sport was invited to participate in this study, and if they were being seen at one of the Emory sports medicine clinics. At that time, if they were willing to participate, we collected some basic demographic information, their height, their weight, And we gave them a pretty extensive survey to fill out. It asked a lot about their training volumes in the week prior to their injury and in the 4 weeks prior to their injury. And then using that data and then also having the ability to go back and chart review, after they had already returned to their sport, we were able to kind of assess their injury type and their return to sport timelines. So that was this big data set that we have. And this paper is just looking at kind of a subset of all the results. So a lot of results we could kind of dig into, but I think if I just want to highlight a few here, and then we're happy to talk about more. And Lindsay, you can kind of direct us from there. So I think big takeaways. One, we confirmed in the study what's already been known, in that specialization, our highly specialized athletes were more likely to sustain an overuse injury compared to an acute injury. Two is that female athletes, even after controlling for specialization and age, were again at higher odds of sustaining an overuse injury than our male athletes. And then when we're looking at those different training characteristics, again, we looked at a lot of them, but the ones that were significantly or statistically different is that on average, females trained for more months of the year than their male counterparts. So specifically looking at more than 8 months, females were more likely to do that than male counterparts. And then also looking at what we call sports to free play ratio. So that's the number of hours in a given week that you're playing in your organized sport, and the number of hours of week that you're just out there having fun, maybe playing a pickup game of basketball with your friends or playing soccer at recess. We ask athletes to record both of those data points because it's been shown that a ratio greater than 2-to-1 of organized sport to free play in the past has been associated with increased injury risk. And we did see in this subset of athletes that female athletes were more likely than their male counterparts to exceed that ratio. I will say that when you dig into this more, it's not the training, the overall sport hours that they're playing. So they're training in their sports for an average of the same amount of time, but it came down to the free play hours. So overall, the male athletes were playing a total of more sport hours because combined their free play and sport hours were greater than the female athletes' sport and free play. But that ratio did seem to make a difference in this data set that we have. So those were kind of the main highlights from a training standpoint. And then when looking at the return to play, again, we did this via chart review and just looking at, was it less than 10 days, 10 to 30 days, or more than 30 days that it took for an athlete to return to their sport after sustaining this injury that they were coming in for. And we actually didn't see in this data set a difference in our specialized athletes and their return to play guidelines. So we have more to dig into there, but I'll kind of leave it at that for now.
Yeah, absolutely. Yeah, I thought, there was a lot of like interesting things that, particularly, the females training more than like 8 months of the year in their sport, compared to the males. Like, do you guys, like have any hypotheses as why that was the difference, or there was a difference with that?
Yeah, I can speak to that a little bit. So when you actually look at the numbers themselves are not that different. So for females, our average months per year that they were training in their main sport was 8.24 months, and males it was 7.6. So when you do the math, it's like 3 weeks the difference, right?
Yeah.
So it's statistically significant. Is it clinically significant? Well, that's where the waters get a little fuzzy, because we do know that female athletes are at higher risk for overuse injury, and there is this correlation. I don't think we have data in this data set to say that it's causation, but that 8 months did seem, that's what has been studied in the past, and so that was why we used that cutoff.
Yeah, that's interesting. Yeah, and then the other one was like with the free play. So I was interested in what all constituted free play, because as someone who works with a bunch of high schoolers, they like my free play that I see of them is like playing Casino Royale and like Brawl Stars on their phone, which would not constitute much of anything athletic. So I was curious, like what all fell into that? Did like weight training or, other stuff complementary fall into free play, or was it truly free play?
Great question.
Yeah.
On our initial survey, we gave some examples, but this was essentially anything outside of organized sport. And so this could be going to the gym and weightlifting on your own. This could be pick up games of soccer, basketball with a friend. For our younger age group, recess, those sort of things are included in this free play. And I think this is a really important thing to look at in terms of males versus females and the sex differences, because when we look at female studies, we see that especially around the middle school age, when females hit puberty, we see a huge dropout rate from organized sport. And this study might suggest that we see a lot less free play as well across the age spans. And then that difference persists throughout adulthood. We never see females kind of come back up in terms of their reported physical activity to the same degree as males. And that happens at the middle school level. And so when we're talking about why are females dropping out? How do we keep them active? What's the difference in physical activity level? It seems to happen around that middle school age. And so if we can address, preventive strategies to keep our females more active, that's going to translate to long-term health benefits throughout the lifespan. And so I think this is a really important thing to think about broadly, especially when we're looking at these free play hours on top of the organized sports that we're seeing females drop out of. So that's how that was defined, but certainly an important aspect.
Yeah, I think, it's funny that when I was kind of thinking of questions for this, like to your point, I feel like we either see kids who are like hyper specialized and they're like doing so much activity. And then we have the other end of the spectrum that like they don't do any activity. And you're like, okay, maybe we need some like middle ground with that. But that free play seems to be like really an important aspect, kind of from all around. And then in general, like, I guess maybe I tend to see where some of the boys that I work with will go to the gym, with their friends, or they will, play pickup basketball or whatnot, versus the girls probably aren't doing that as much. So, trying to have things to encourage that. But
Yeah,
do we think then that with that's because they're doing these other movement patterns and whatnot, that's helping to prevent the overuse, or is that kind of our thought process with that?
yeah, maybe I'll say
Yeah.
something on this. This has been a cultural shift. When we first looked at our first data set, when we published on the first set of population of injuries related to specialization, I was kind of looking at the data and we analyzed that our mean amount of organized sport was twice as much as free play. And so when we did that, we knew that that was a cultural shift. And I knew when I grew up in the 80s and we were doing the opposite. We would play mostly for fun, and then we would do some free play. Some organized sport at times. It just so happened that also increased your overuse injury risk. And I'll point to another paper that we wrote on socioeconomic differences. And we found that those that came from higher socioeconomic backgrounds had less free play, higher rates of specialization, higher rates of serious overuse injuries. And then those with lower socioeconomic backgrounds actually had more physical activity. Most of it was in free play. There was no parents around. So how Stacey defined it is exactly that. And so that cultural shift is what we're seeing. This is the first paper we see when, us three were looking at with the statisticians. We were like, wow, like it's actually, it really reflects on what you're probably seeing is how often do you see girls just playing for fun,
Right.
out in the park? It just doesn't happen. And so
Right.
I think that's a problem for all the more public health issues that Stacey and Anna are talking about.
Yeah, absolutely. And then bringing up the socioeconomic, standpoint, obviously working with a lot of golfers, for the most part, they're fairly affluent. And so everything is very structured and we have all of our activities, and you're not seeing as much of just, yeah, go play with your friends somewhere, right? But, things to hopefully maybe encourage and whatnot with our kids.
I'll jump in here too. I also was curious as to how much of, we're recruiting at a specialized sports clinic, and that's the population we're seeing. How many athletes are, not seeking medical care, or just, having their coach tell them to ice it for a few weeks, or just seeing their like pediatrician or, family med doc. And so I also wonder how much of that's coming into play here with the population that we're seeing.
Yeah, absolutely. What what type of sports were you mostly seeing? Like what did the people that you surveyed mostly, what were they playing mostly?
We're gonna throw Dr. J under the bus here.
Okay.
Our we were not that generalized. I think we hoped it to be. We recruited for everyone, but we had a lot of tennis players, and I don't think that that's a surprise. I will say, thinking about how some of the other factors going in, football is was one of our next highest sports in our male athletes, and that's a seasonal sport. So I do also wonder how much that contributed to, if we're only seeing a 3-week difference, the fact that just guys were playing football, which is by nature in our country and part of the world, a seasonal sport, where they're not, having the opportunity to play that year round. How much was that driving that number that we saw in this? I don't know, because there wasn't an equal comparison for female athletes there.
Yeah, absolutely. I mean, that's one of my questions with the sport, because when they talk about, hey, we like multi-sport athletes, like if you're playing football, it's seasonal to your point. So you can probably play football and then run track or play baseball or whatnot. With golf or tennis or some of these, I mean, it's just like golf is in Ohio, high school golf is literally starting right now and it's a fall sport. But that's like high school golf doesn't even count. No one cares. We all only care about the spring and summer. And so it just continues and continues, and there's really no off season. And so, that's where we start to really see the sports specialization and some of those overuse injuries for sure. But I'm guessing, did you guys see similar in tennis?
Yeah, I mean, our sports specialization and our tennis players is high. I think those individualized sports, and particularly some of the sports that attract females, gymnastics, dance, ice skating, those sort of things, we actually had lower numbers of participants in those sports in our study. But those are obviously sports that are year-round. Athletes tend to peak at a younger age, so kids tend to specialize earlier. I'm seeing that a lot with runners these days in the Northeast as well. Obviously, that's a lot of what I see in my clinic. It tracks a high population of individuals who are underfueling. But it's interesting because the culture in the Northeast of what I'm seeing in clinic with a lot of my specialized female athletes, which is a lot of what I see, is really driven by the culture and some of the schools up here. We have a ton of private schools, and our private schools require our athletes to do a sport every season. Some of our individuals choose to do a different sport every season, but some kind of choose to do the main sport. And then to your point, Lindsay, they're doing town sport, which is required for club sport on top of that. And so not only are they doing their sport year round, it's like triple the sport at the same time, right, on 3 different teams. And you try and talk these kids out of doing this to develop more neuromuscular movement patterns, which was to your earlier point, what is, do multiple sports help decrease injury risk? And absolutely, a lot of that research has been driven by Greg Meyer, who's now down at Emory. But these neuromuscular movement patterns are protective against these overuse injuries. And so trying to convince a high schooler of that or a middle schooler of that is very challenging. And it's something I have to try and do on a daily basis in clinic. But truly, when we look at the data at the NCAA level, most of the athletes who are making it to that level were multi-sport athletes at a young age. And so sometimes talking about that data can be helpful for those patients to understand that more is not more. Doing more of the same sport doesn't necessarily make you a better athlete. Sometimes less is more. And that's truly a lesson for these overuse injuries.
Yeah, absolutely. I mean, and I guess that if you're talking to an athlete or probably their parents as well, like what are some of the recommendations that you're giving to them? Because obviously it's really nice to say like, okay, well, I think you should like maybe take a step back, and not do your sport as much, but people then have meltdowns and like, what if I'm not practicing, then I'm not going to make this and I'm not going to get that. And it's a lot. So what are you guys saying, or what are your suggestions, or what have you found to be helpful?
Yeah, I mean, a lot of this comes back to the sports specialization research, even prior to this article that Dr. Jayanthi has done with the risk factors of overuse injury. And so doing your main sport less than 8 months of the year, practicing your organized sport less hours per week than your age is a really easy one I give to some of my young athletes, particularly my gymnasts. That one comes up a lot. There's 2 different types of gymnastics now, and sometimes that comes into the conversation. Which type of gymnastics should we be choosing at a young age? More of the recreational or more of the competitive? And sometimes talking about these risk factors when you're seeing an athlete as they're injured in clinic, really can help drive that conversation. The organized sport to free play ratio is a tough one to sell people on, to be honest, but I encourage more free play. Of course, like, hey, if you can, you can't necessarily convince a runner to go play tennis on their off season. If you could, that's great, but they don't always want to do that. But sometimes you can convince them to do other things with friends, and that's where that free play comes in. So all of those risk factors we know from prior studies increase the risk of overuse injuries. And so those are the topics I like to bring up clinically with patients or their parents.
Yeah, absolutely.
I'll chime in one additional thought.
Yep.
You can see why I don't have to say much because Stacey and Anna are just so knowledgeable. I just love listening to them. But just to piggyback what Stacey said, I really am intrigued by the stage of development now. And so I think there's a point, and you work with, elite level golfers, and if you work with elite level athletes, there's a point where you have to go all in if you want to be at the highest level. The question is when you go all in. It's not necessarily based on age. So we published also in Sports Health, like how to train an elite specialized athlete. And so you follow the rules that Stacey outlined and you make a developmental approach. So when you're pre-adolescent, do you go all in? And the answer is probably not, even though we might see that. And this is not necessarily the injury risk. It's about performing your best at the right time. And so if your goal is to be the best 12-year-old, it's actually pretty clear you can be the best 12-year-old if you train like hell from 6 to 12, but the likelihood you'll be that successful later. So I use a developmental approach now. I really like, and that's where we actually, Anna helped, our next study, we do, sex aligned sports or gender, what do we call it, Anna, again? Gender equivalent sports, right? So we took up all, and sex equivalent sports, right? Is that what we called it?
Yeah, probably sex.
Yeah, sex equivalent. So then it was, soccer and tennis and these, and we try to give counseling based on your stage of development. So we have an interventional trial right now where we give counseling on all these recommendations that Anna and Stacey have talked about that are based on your gender and your stage of development. And we try to individualize it. And I think that you get more impact. So we're still in it for the long haul. Hey, when you're skeletally mature and you want to go for it, you have to train intensely and just be out there, and you have to take risks. And sometimes you're going to get hurt. And then that's where we're here for.
Mm-hmm. Yeah, that is something I look at a lot in my clinic too. Just thinking about bone stress injuries or overuse injuries is where someone's at in their growth curve. So I look at growth curves a lot. And this gets at one of the measures we did in our paper, which is not based on chronologic age, but rather kind of where someone is in terms of their maturational stage. Because that peak height velocity where kids are growing the most, that's where they sustain the most overuse injuries, just because of that growth rate of that quick rate of growth and that change associated with that. And it's really interesting. It's easy to engage patients in that conversation because every patient is excited to know, how tall am I predicted to be? Where am I in my growth chart? Before my patients are even roomed, this happened today. I'm working in a new clinic and the scale and the height measurements are closer to me. And pretty much every patient who came in was really excited to ask our medical assistants, like, what is my height? Where am I at today? Those sort of things. And so when you can pull up that growth chart and say, this is where you're at, this is why this matters, it's, I think, a easy way to pull in those families to those conversations and help reduce the risk of injury long-term.
Yeah, I found that interesting that the percent of like adult height. Yeah. Will you expand upon that just a little bit more and like tell like how that's calculated?
Yeah, so the percentage of predicted adult height, it's a complicated equation. It's been out for a while. Basically, you take mom and dad's height, you take where the kid is in the growth chart, and it's more based on a maturational state. So it charts their height, charts mom and dad's where they might be from a predicted height standpoint, and then predicts how close they are to their predicted height. It's not a perfect measurement. I think it says it in our paper, but it's validated in white males. And so what we found through our study is at the extremes of height, it tended to be less accurate. So we could have misclassified some of our patients, but I think it's a good starting point in terms of predicting height versus using the old school mid-parental height, which takes mom and dad's height and adds some for males and subtracts some for females. That tends to be more inaccurate. as one of the endocrinologists I work with closely always says, genetics doesn't average, right? And so if genetics averaged, every sibling would be the same height. And so these are rough tools we can use alongside growth charts to help predict where someone is in their growth curve. And I think that comes into play particularly from the sports specialization perspective, because 12-year-olds can be at very different points of their development and at much different injury risk profiles. And so it's an interesting thing to think we, group kids in America based on their age more often than not at these young ages. But is that the best way to be grouping kids from a sports injury perspective?
Yeah, that's super interesting because particularly in the boys that I see, I've got 12-year-old boys that I work with who are already 6'4" and are, have facial hair, and I have ones that look like they're 9 years old and they're competing against each other. And obviously there's like performance things with that, but then it's also, from an injury risk, the ones who are, you start to get the tendinitises and things like that, and the ones who are growing. But I would think that using that like calculation would be a great way of also kind of talking to kids and parents of, hey, this is where you are in your growth curve. So we're not just giving these like recommendations because we're just the mean ones who don't want you to play as much. And, there's like actual science behind that type thing. So
yeah, there is some online calculators for it. You're just going to have to validate them and make sure they're accurate in the background. But that's what we use for the study. So if you have biological mom and dad's height, the kid's height and age, then you can plug it in and kind of calculate this, which is great.
And the thought would be then also if you are in that kind of like peak growth phase, that may be a time to kind of slow down on some stuff, just because you're more susceptible, right?
Yeah, absolutely. We see a ton of growth-related injuries like apophysitis, overuse type of injuries in that time period. It's when I see our peak bone stress injuries in my clinic. Bones grow long before they grow in, and so bones are going to have lower density during peak height growth periods. And so absolutely, that's a time period where if you're seeing a lot of injuries, modified play can help decrease that injury risk profile.
Do you guys see where, because oftentimes like the first time we see them is once there's been an injury. And so people are often a little bit more, open to suggestions once there's been an injury. And it's the same thing, Keith, we're talking about ACL stuff. Like no one cares about ACL prevention until you've torn your ACL, right? And so, trying to get that message out before injuries have occurred. Are you guys getting to, do you have any recommendations or that? Or are you guys seeing people, prior to injury? Or are you guys seeing them usually on the back end?
Yeah, I work in an interesting space where sometimes I do see them prior to injury, right? Because they're coming in with sports performance concerns, fatigue, menstrual cycle irregularities for my females. So I sometimes capture them before the injury happens, just from that perspective, when they are at a higher risk for various reasons. But I think this is a great topic to go and engage your community. And a lot of times I have parents who were talking about one kid and they say, hey, I would really like to have this conversation with my other kid. Can I bring them in for that? And I always say, yeah, sure. We're happy to do a preventive sports visit, like no problem. Or is there a team or a community that we can go give this talk to on your child's behalf? And I think there's really been kind of this change in perspective of my parents who are coming in, where parents are getting more interested about preventing injuries and what goes behind that, even before sometimes I bring it up. Like a lot of times I'm putting the big picture together of what is our risk profile or different risks for this bone stress injury, and parents are coming in excited to talk about that. And so I do think there's starting to be some slow movements where people are more excited, for example, prior to an ACL, and it's just getting the community knowledge and then the resources out there, right? That's what's lacking sometimes, are these resources or programs for the teams and communities.
Yeah, absolutely. Go ahead, Neeru.
I was gonna say, do you wanna, there's some knowledgeable people on the call too. Do you wanna
Yeah.
see what their thoughts are too?
Yeah, absolutely. If anyone has any questions.
Yeah, feel free if you want to drop it in the chat or come off of your mic and ask a question.
Not to interrupt, by the way, you can keep going through your questions, but just in
Yeah,
case.
you're good. Yeah, don't be shy.
Well, that's one that I've been thinking about a little bit, and this kind of stems from I during physical therapy school I coached track and field for a while, and one of my athletes that was probably the best athlete on the team was always injured, and one of the problems that she had was she wasn't specializing in sport. She was trying to play multiple sports all the time, essentially. So she was, doing track where she'd show up maybe twice a week for track practice, but she had softball going on. And then she was also one of the best basketball players as well. So she'd be like balancing club basketball with high school track with high school softball all at the same time. Is there a way, or is there anyone trying to tease those individuals out in this data set to say, you wouldn't show up as somebody who's sports specialized likely unless, I mean, maybe from the 8 months a week of your prime or 8 months a year of your primary sport, but I think that's
So
a whole different animal.
yeah.
I don't know.
No, it is actually, and that's we talk about every scenario you can think of ad nauseum. David Bell and his colleagues over at Wisconsin, they published a bit on this and try to define that. We call that I think they end up calling it the multi-sport specialized athlete. The NATA came out with updated recommendations that suggest they should not compete in two sports the same season. And so when you're talking about multi-sport play, you're talking about seasonal multi-sport play. But I'll be honest with you, I have two kids and I break that rule all the time. They play tennis matches during baseball season. And so I get it. So, I don't know if I'm a worse parent or a worse researcher, but I'm not perfect at either. And so kind of packaging it isn't always that easy, but it is definitely a concern. But then I think the cumulative volume does matter. And so while we can say specialization is an independent risk factor, there is a level of cumulative volume that matters in recovery and other elements. So some of the best athletes we know are the most also still the most vulnerable to get hurt because they're utilized so much. So yeah, and that's a common scenario. If you look at our OJ sandpaper, most of our injuries, we followed them for 3 years, most of our injuries were the same people. So they're like, and I think you all see this as well too. There's repeat customers. And so we get a lot of that. And, that's specialization, but it's also, it is volume based and lack of recovery and neuromuscular control and all these things that they talked about.
I think there's a question in the chat I can address. The question is, do you have any ideas, recommendations on how we could screen for overuse risk more effectively in our clinic schools, especially among highly specialized female athletes? I think this is a great question, and part of this comes down
Perfect for you, Stacey.
yeah, part of this comes down to like your rapport with the athletes and what you're comfortable asking.
In your paper.
Yeah, so one of the things we think a lot about in the middle school, high school population is how many overuse injuries have you had previously, right? One single overuse injury or bone stress injury or any of these things is a risk factor for an additional injury. So that's an easy one you can ask, or are they coming into your clinic often with injuries? That's a patient you might want to flag to send into a clinic for kind of a prolonged conversation. I think at pre-participation physicals, asking about menstrual cycles, and I've kind of flagged my pediatricians in the community to do a better job of this, but talking about menstrual cycles at that time, if a female is not having a normal menstrual cycle, that is a red flag. So I teach every female who comes into my clinic, where we're doing kind of a more full evaluation and screening prevention visit for risk factors for overuse injury. I always say, having a normal menstrual cycle, like a regular monthly cycle, that's like taking your temperature when you're sick, right? So there's this myth that if you're doing more and you're having lighter, shorter missed cycles, it's okay. It just means you're training more robustly, right? That's absolutely false. I tell every athlete that. Because it's still coming out. And a lot of parents heard that when they were young, like, oh, it's okay that you were missing your cycle. It just means that you were training regularly. And so I tell my athletes, missing a cycle is a sign that your body's not healthy. Everyone gets one free miss because that can happen from emotional stress, like it's test week at school or something. That's okay. But if we're seeing a pattern of lighter cycles, shorter cycles, missed cycles, that's a reason to get into your physician and have a more in-depth conversation about why that might be occurring. It might be underfueling, it might be related to some of these injury risk profiles we're talking about, or it could be a different medical reason that also contributes to injury risk and overuse injury. So those are kind of the main ones from a female athlete perspective that I think about. You can always ask, like, how's it going with nutrition these days? Are you finding time to eat? Like, let's talk about how nutrition could be impacting this. And a quick 24-hour recall for a patient, like, what'd you eat today? A lot of my athletes who are not doing well will have had one meal by the time they see me at 2 p.m., right? You don't have to be a dietitian to know what's adequate or inadequate. And so I think some of this comes down to, like, what's your rapport with your athletes? How in depth do you want to get? But if you don't have a strong rapport, or you're not comfortable asking some of these questions, a quick, how many times have you been injured in the past year, is a good screen to say, are we at risk for recurrent injuries? Yes or no?
I think that's a great, like, bringing up the nutrition and then even sleep and things like that. I mean, I have a number of my athletes, the boys who all want to gain weight, and then you're like, you had goldfish today, so that's probably not going to work. And then the girls who like only have Starbucks ever, that's all meals. And yeah, so I think that's a great conversation. Have you guys seen anything with like sleep and recovery from that standpoint, and with the overuse injury or other?
Well,
Yeah, I mean,
yeah, go ahead. Yeah, no, I mean, we definitely, we as a group didn't specifically research because we know the data's out there. We have this interventional counseling component. We added it to we have 12 healthy sport recommendations that we send out weekly. We actually do them by video, like sort of like TikTok style. Anna started it too, and my kids, but sleep was one of those. And we know that it's a big barrier, and it is a risk factor for injury and performance. So we did, acknowledge that. We acknowledge nutrition in our video, and so, but that's just a starting point, just educating them on. But actually, the compliance. Dr. Ishii Haruki is one of our former fellows, just joined as well too. He's one of our lead investigators on this paper, and we're trying to see if there's adherence to these recommendations too, and that's the trick. We published in BJSM, that these probably are the right things, but we're not seeing the adherence, and so it's not the research anymore; it's the education. How are we delivering it? So, using phones and video, it seems like a good thing. Short 30-second style things when you see your doctor may work. And so when is the best? Physical therapy actually has the best time. You have an ongoing relationship. You're seeing them frequently, and so you probably have a better chance than we do. So but anyway, we're open to ideas of how to deliver those messages.
Yeah, and I'll say my physical therapists in my community that I've gone on and given talks on sports specialization and overuse injuries, they do a great job of flagging the stuff for me, right? Because as we have maybe a 20-minute conversation with our patient, you guys are seeing them on a weekly basis. So sometimes we don't get all of that information, and that comes out as you get to know them and they say, hey, Dr. Schley, I'm kind of concerned XYZ more might be going on with this patient that's contributing to their injury risk profile. Can you have more of a conversation with them at next visit? And I have a great back and forth relationship with all of my physical therapists on this. And they catch a lot of these things for us. So that's great. Yeah.
Yeah, that's awesome. Looks like there's another question. So, any advice on how to educate or counsel athletes that choose to specialize, balancing the education piece on the injury risk associated with specializing while creating the best training plan to keep them healthy? This is always a tough conversation with patients and families, particularly when they are just set on like specializing in one sport.
Anna, you've done so much work in this area. I'm going to let you one off.
I mean, I think some of it comes down to how do you mitigate other risk factors. So if you want to just do one sport, like that's what's best for the patient, that's what's best for the family, like they can do that. So the risk factors, the training things that we've kind of already touched on, when you're a young athlete, can you play less hours per week in your sport than your age? We already talked about that. maximizing free play. So trying to minimize organized sport, maximize free play. Other ones is thinking about your training volume week to week. So it's something we call like the acute to chronic workload ratio. Trying to keep week to week volumes not too dissimilar from each other. That can also be a risk factor for injury. And then the other thing is looking at competition play versus just overall training in a given week. And there's the ratio that's like has been shown in the literature is 1 to 3. So keeping that overall competition hours per week at less than 1 to 3. And some of this, we're hoping to kind of an area for research in the future is how much of this also is dependent on developmental stage. So can you kind of push the boundaries on some of those factors if you're in the like peak height changing period of time? Can you do a little bit more competition versus training if that's what your sport entails? So more work to come on that.
I think that's really interesting. Like I see a lot of kids who they they decide they're going to do like, just golf, and they've done other stuff, and then they go, oh, I gotta catch up, right? And then their parents put them in a ton of tournaments, and it just tournament. And it's like you don't have any time to just be a kid, but even work on, play, or even do just your practice, or, other training, because it's just tournament. And that's kind of at that like 8th grade freshman year often, where it's like once they are more developed and they've, then it's like, oh, they can tolerate that a little bit more. But I really think, like, as we've all kind of said, the conversation with the families and the parents is the really challenging one. I know that, we, with just even like college recruiting, like they can start talking to kids the June of after their sophomore year. But like we have kids who, when they, decide they're going to verbally commit to a school, the coach is like, I've actually been watching you since you were 12. Like I knew that, right? And so it's almost like if you decide that, okay, I think I want to play this sport in college, particularly a golf or a tennis or something like that, and you decide that junior year, best of luck, right? Because now you're already in the 9th inning, and like, with the limits and roster sizes and all the NIL and everything like that, it's just like, that's going to be harder. So I think we're up against those pressures as well, which I'm not sure we can do anything about, but
And then I think another piece to all of this, and Dr. Schley can probably speak more to this, is the recovery piece of it all, right? Like, are you getting an off day once a week? Are you eating enough? Are you sleeping enough? Like all of the recovery is huge. And then something that we've talked about too is, even within your sport and, developing those different neuromuscular patterns, like, are you, cross training in a way that's, you may not consider it a different sport, but it's, that's strength building to help prevent overuse injuries.
Yeah, absolutely. I think that's a challenging topic. And sometimes I can't convince my athletes until we've tried it and it works, to be honest. Like that is the honest truth. As some of my athletes who are my frequent flyers who are coming in with recurrent injuries, I'd say, I know you're not optimistic about this process, but this is what I do every day. Let me be optimistic for you. And at some point, you're going to be a better runner or ice skater or tennis player or XYZ because of this. That's what all of the data shows. And so let's trust this process during your injury recovery, right? That is a time we're capturing this athlete and they can't maybe do those same movement profiles over and over again. And I say, let's see what happens on the other side of this. Just today, for example, I saw a patient who's a swimmer, specialized swimmer, 2-a-days, no days off, high schooler, right? Like, I'm like, what are we doing? We got like, even my elite athletes have to take 1 day a week off of relative rest, right? And we don't need to be doing 2-a-days. Finally cut back to 1-a-days, and she's now performing better than she even did. And so sometimes it's this injury period where they have to cut back that we can kind of convince them to do so from an injury perspective. And then they're a stronger athlete at the other side of it. And I think that's where some of this recovery conversation, or just showing the athlete that, like, as I said earlier, less is more, that is such a tough thing to convince athletes of. But when you get them there and they see their performance improving, then that's motivating for them that this works. I think there's also a lot of great pro athletes and elite athletes coming out and speaking on this right now. And I think those accounts are good ones to know, right? As Dr. J mentioned, TikTok, Instagram, those things are what our athletes are looking at these days. And plenty of studies have demonstrated that if there's misinformation on social media, as physicians, if we comment on that same post, it actually just pushes out the misinformation. And so the best way to fight these misinformation posts is to join them. And so if you're not an Instagram person, just know what those accounts are, or TikToks, know what athletes are out there talking about this. And you can say, look, it's working for X or Y-Z within the sport. And that might be someone that they consider a mentor in the field, right? Or that they look up to. And sometimes that is the motivating factor as well. So I keep a lot of those in my back pocket.
I think that's great advice because, you know, I mean, what do you know? You only went to med school, right? But obviously this, you know, NBA player knows way more than you, but
Absolutely.
like they will, they will definitely listen to that for sure. So I think that's great. That's the, it says, so figure 2 of the article, so on page 8, shows that highly specialized males had more acute injuries while females had more overuse injuries. Did the results of the male sample group size surprise any of you? And do you have any thoughts as to what that could be attributed to?
So all of our athletes were injured athletes. So everyone had to kind of have either an acute or overuse injury. So it wasn't super surprising that our female athletes had more overuse injuries, that our males had more acute injuries. Again, going back to why this is, could it have been sport type? Could it have been football? We know that's a big one. That's acute injuries. We had a lot of concussions. That's always a huge, that's probably was our #1 acute injury. So was that coming from the specific sport that males were choosing? Possibly. So I wasn't surprised by it, but yeah, definitely something to also talk about.
Yeah, when I read that, I kind of attributed that probably to the sport type. So also with someone who works with a ton of boys, some of them are just not so smart sometimes. So yeah, I guess, you know, with all of the injuries, they were from their sport though.
Yeah.
Right?
Yeah. It had to be from their sport. Yeah.
Okay. Important distinction. But, yeah. Very cool. Any other questions or anything, any other advice or pearls or things that you guys want to look at in the future? I know we've talked a little bit about it, but kind of what's next, the pipeline from a research standpoint from you guys?
Before I say anything, Stacey or Anna, do you have anything that you guys are kind of have in the pipeline?
So I'm doing more work in the red space. So, you know, this paper talks a lot about extrinsic differences or factors between the sexes. When we think about females and intrinsic factors, you know, ACLs is one of the most studied areas for this in terms of differences in anatomy. But we're looking at some research in terms of bone mineral density by sport type and how that contributes to bone stress injury. Obviously, we would expect maybe a gymnast to have a greater bone density than a swimmer, right? And so some of our cutoffs per the sports guidelines on what we consider concerning from a bone density perspective, we use a traditional cutoff of 1 standard deviation below average bone density. And so we think that can differ a lot by sport type, and we need to look more at that. I think, you know, preparing for this lecture, Lindsay, you had brought up hormonal profiles. Such an important topic and a hot topic, and athletes are getting into menstrual cycle phase training. There's no literature really to support that, just FYI, in the robust studies. But I think when it comes to research on do hormonal profiles contribute to injury risk, it's a really tough thing to study from a quality perspective, because the best way to do it is serial blood work, because we know that females don't predict their menstrual cycles very well, even if someone's having a normal 28-day cycle, in terms of determining the different phases and when we expect hormones to peak, because estrogen peaks early and then peaks a little later and progesterone peaks late. that can be really tough because the same 28-day cycle for one person, the midpoint might be the 14-day point. For another individual, it might be the 10-day point. For another individual with the same 28-day cycle, it might be the 18th day point. And then we have to think about the contraception use in our society, which we're giving people exogenous hormones that control what's happening with the menstrual cycle in a different way. And so a lot of the studies that exist have really, really poor quality. It's a question I get a lot. Do hormones affect injury risk? And I think the answer is absolutely yes, but we have yet to prove it, right? And it's just a tough study to do. And so it's something that we think a lot about with our female athletes as well. But I think when we think about these sex differences we're seeing, we need to think about the intrinsic differences as well in terms of our males and our females and what else might be contributing to these risk profiles.
There's a lot of different directions. I'll just keep it brief. I think there's just one on the education side. What are the best ways to deliver the already really helpful information that we have, and to get young athletes, parents, coaches, and engaged in that. I think all of us on the call and all of us in our sports organizations medically agree with all this stuff. That's not very hard to do. It's hard to get the actual people on board. And then I think we've talked about it before, is study the resilient athletes, the people who actually don't follow any of our rules and actually do great. And so it's tough to design, but we're kind of thinking about how to best study that. But anyway, I have a lot of theories which will be on the scope of this, just like Stacey does on her stuff. So I'll just say, thank you so much for having us. And again, I'm so proud of our authorship team, and I wish I could keep Anna and Stacey with us forever, but they have to grow their own path and career somewhere else, and they're just awesome. So keep looking up for their work, and thanks for having us on.
Yeah, absolutely. I really appreciate you guys. And I think this has been a great discussion. And can we just blast this to actually everyone, not just sports medicine people, like parents, you guys should listen to this, just by the way. So yeah, I think that's great. So thank you.
Yeah, awesome. Yeah, thank you everybody for being here. We really appreciate it.
Absolutely. Thank you guys for joining too, and our audience.
Yeah, thanks.
Bye, Anna, Stacey.